I have with me two amazing labor activists, Mike Robertshaw and Terry Mogilles. Um, they are two uh, uh, running some labor uh, programs in Louisiana, uh, which I thought was very interesting, and they work with nurses, some nursing unions in Louisiana, and I brought them on to talk about their experiences and where they think the labor movement in the South is headed. So, if you'll uh, please, uh, you guys, introduce yourselves and tell me a little bit about your work.
Um, I will start. That's right. My name is Mike Robertshaw. I'm a licensed RN in Louisiana. I have been a nurse for about 5 years now, a little more than 5 years. It was a later in life career change for me. I have done organizing and activist work professionally. I've done a lot of different things, but I had been feeling a calling towards nursing for several years when I finally decided to make the jump. I'm 50 now, and yeah, so I got into I quit my job and I went back to nursing. I went to nursing school and started in the hospital right at the beginning of the pandemic, and so I've been a nurse for about 5 years now, and have been involved in this union effort. Um, since back when we started. And, it's been quite a journey. Um, so I think that's kind of my basics. Like I said, I live in Louisiana here, and Miss Terry and I have been working together as, colleagues and comrades for quite some time now in this fight, which has just been really, intracted. But we just just got to keep fighting. So that's kind of what we've been doing. So.
Cool, cool, Terry, take the floor.
So I've been a nurse just a tad longer than Mike. This will be my 48th year. Nursing primarily in Louisiana, primarily in the community. About 2 years ago, I have been doing community-based nursing for a very long time. Activism all my life. 2 years ago, went to work at University Medical Center, which is the open access level 1 trauma hospital in New Orleans. And was so happy to be able to have my years of activism and healthcare collide. I'm having little visual issues here. And years of activism and healthcare collide. And that's where Mike and I started joining forces to really engage the community into our fight, our union fight, which transcends just the hospital. We're fighting to improve healthcare in this community altogether. New Orleans was unique in that it was part of a state-based kind of open access free care system for like 300 years, since the 1700s. Post Katrina, that hospital, which was called Charity Hospital, and I encourage anyone who really wants a good history to go to our website, Charity Betrayed. They used Hurricane Katrina to close that system and privatize. And so that's what we're struggling with. The community is not used to big medicine. We were used to open access, never got a bill, free care for all, hospitals around the state. We're just having a hard time as providers and recipients of healthcare in New Orleans. So we decided to join this union and make our fight public for the community to understand. Yes, we're fighting for better working conditions for us, but we're also fighting for better healthcare overall.
Wow, I did not know that. That's very interesting.
Yeah.
Yeah, for 300 years, you said it was.
Yeah. Yeah. 17, what is it, Mike? 1797 or something? A French sailor willed the land that became Charity Hospital, and existed until Hurricane Katrina in that format. 10 hospitals, 278 beds at the charity hospital here. The School of Medicine, Tulane and LSU trained there. There was a School of Nursing, the Charity School of Nursing. So it was quite massive. And big medicine and corporate America just couldn't have that, in a word.
Okay.
Yeah.
So, could you tell us about some of the challenges that you run into in the course of your organizing work? Um,
I
as
let
far
Mike do that because
as some of the
Mike's
push,
been very challenged.
yeah.
Mike has made the ultimate sacrifice, so I'm going to let him speak to that for a minute.
Okay.
Yeah, sorry, my eyes are dry right now. Well, I think Miss Cherry can speak to that, particularly in the conditions that she works under, and so many of our nurses work under. I think it probably would be important to start by just talking about the conditions in the hospital. You know, Nurses have been striking around this country for years, decades. But particularly since the pandemic, we've seen nurses going on strike all around the country, and it's always the same issues: safe staffing. There's something called staffing by acuity. So I remember this from nursing school. I'm sure Miss Terry does as well. You go to nursing school, there is data driven, evidence driven numbers on ratios on particular units that are the safest ratios.
Mhm.
If you're on an ICU, it's 2 to 1. If you're on cardiac step down, I think it's 4 or 5 to 1 patients per nurse. And in hospitals, because they want to cut costs, will tend to overload nurses with patients, and it is just really unsafe for the patient, of course, and it's really unsafe for the nurse because you miss things. And that has been a real problem around the country, as Ms. Terry talked about, in our medical system just being corporatized and privatized. And so safe staffing is a big one. Adequate pay. So nurses are continually asked to do more and more and more for the same pay or less. We have nurses that have not gotten a raise in 10 years. And because of all that, we can't keep nurses at the bedside. Nurses continue to leave in droves because they work so hard to get these nursing degrees, and then they get onto the hospital floor and they think to themselves, "Oh my God, what the heck did I sign up for here?" And they head out. They either go take a travel assignment or, just something that doesn't put their license at risk. And nurses put their license at risk on every single day. So I think we formed the first nurse union in the Deep South. I think so. We have unions in Texas, we have some in Florida, and then we have in North Carolina our nurse unions, but nothing in between. And we passed that union election by 82%, recognized by the National Labor Relations Board, and we've been in a contract fight now um, since March of last year.
Mhm.
And we have been on 4 strikes. We've done multiple pickets. We've done a lot of shop floor actions with petition deliveries. Um, we have just done constant actions to try to agitate and get a contract because they just done nothing but stonewall and delay and gaslight and intimidate. And I, as you know, was terminated for union organizing, but that's happened. That's continually happening. Nurses are being penalized. Uh, uh, it's just a constant thing of intimidation because the hospital's goal is just to wait us out. And so if you really think about it, it's like we've been doing this now for, I mean, a year and a half, a little more than a year and a half. The hospital has spent tens of millions of dollars fighting us instead of just selling us contracts so we can just go and take care of our patients. So I'll stop there. Ms. Terry, I don't know if you want to add some more because obviously you have your own challenges in the clinic, and yeah.
Yeah. Well, I work in the clinic. Mike was working in the burn ICU, and the stories are the same wherever you work. We chose to work in a large open access community based hospital We see everything about everything there. And so it was a conscious decision to work in an environment we knew where patients really were needed. We went, every nurse in there knows she's working with the most disadvantaged members of this community. So we are not afraid of the work, but we want to be compensated fairly, and we want to be able to give our patients the best possible care and not go home feeling morally depleted. I work in an orthopedic trauma clinic, and that clinic sees every gunshot wound, motor vehicle accident, falls, flip. After they're patched up, they come to that clinic. Because the hospital does not want to pay for nurses and would want to hire less qualified people to work, or there is not a big of drive in our hospital, but the drive for AI is approaching fast. Well, there will be, nurses providing care that are basically robots. But what I'm seeing is just a total lack of devaluing of the profession that I've had for almost half a century. I've never felt so devalued. Um, Tomorrow, when I go to work, there will be 242 patients scheduled in my clinic. I'm the only nurse. I work with,
242 patients.
that is correct. That is correct. So there is no way I'm going to be able to do the adequate discharge procedures. I run around much like the chicken with my head cut off because we are a resident-based clinic. So there are young doctors who need, guidance. These are post-op patients. So it's not a regular clinic visit. Many of them have just had surgery. Um, so I do go home morally depleted. My shift starts at 7. It's supposed to be a clinic. It is not uncommon for my clinic to end at 6 or 6:30 in the evening. It's impossible to get to that many people. People leave without being seen. People don't have the surgeries that they need. It is not safe, and it is demoralizing. We know the needs are great. We have a large homeless population. Many of my patients get hit begging in the streets of New Orleans. So, I mean, it's not just I'm taking care of you because you have a broken leg. I'm trying to find housing for you. I'm going down in the cafeteria and getting you food. You don't have any clothes. It's a plethora of things. And that's hospital wide. We want to be able to take care of this community. We know what is needed, but it's not the things we're asking for is going to cut into profit, quite simply. It's going to cut into the $20 million that the CEO has made since what, 2023, Mike, or something like that?
Yeah,
It-
he makes about $3 million a year.
yeah.
$3 million
And that
a year.
$3 million a year. Again, coming from a system where it just wasn't like that. It was a doctor-led system. The doctors ran the hospital. So it's so many things, Marcus. And this is not just here. It is nationwide. It is really international. I just came from a global nursing um, seminar in San Francisco. And even in countries where it's socialized medicine, privatization, can't say it, corporate medicine is creeping in. Go countries, England with the NHS even, corporate medicine is creeping in, and slowly, their systems of healthcare for all is eroding. It was kind of scary for me to hear those stories.
So, wow, that's quite a lot, actually. There's a lot to unpack there. Um, wow. So were you guys, so was your hospital acquired by private equity, or what brought in these sudden changes?
So, well, Mr. Maybe you can answer that. I'll just tell you that I can I want to answer just one thing in terms of uh the timeline, and then maybe Mr. You could take that one because I'll be honest, I actually
Mhm,
don't know the answer to that other than that's what's
mhm,
happening to healthcare all over our country. Um, uh, so we used to have many hospital systems, as all over this country, right? In communities, there were little community hospitals everywhere, and that has continued to shrink and be bought up by big behemoths, private equity likely. Um, and so in our community, um, we had, well, after the closure of Charity, we had 3 hospital systems. We had the 2-lane system, which was owned by a company, a national hospital or healthcare company called Healthcare Corporation of America. They're a for-profit corporation, one of the worst in the country. Just constant, they've been investigated by attorneys general, I think, in North Carolina, a few other states. But they owned the 2-lane hospital system, which was 3 hospitals. Then you had Louisiana Children's Medical Center, which has been rapidly expanding since I think it's been 2010. And then you have the Ochsner system, which owns hospitals, I think, from Texas all the way to Florida, maybe even into Georgia. So interestingly, usually it is the big for-profit hospital or the big nationwide nonprofit hospital. I'm doing air quotes here because that doesn't really, as a nurse, as a working wage person, there's very little difference between the two. Having worked in a for-profit system and a nonprofit system, as a wage worker, and particularly as a nurse, there is no difference. I will just tell you that as a witness. In any case, we had started this unionizing effort at 2-lane when it was owned by Healthcare Corporation of America. Interestingly, it was the national organization that was bought out by a local organization, Louisiana Children's Medical Center, LCMC. So they purchased all of the 2-lane system, thereby now owning, after the end of that purchase, which happened, I think was finalized in 2022, 56% of the hospital market in our community. The rest is owned by Ochsner. So now we have a duopoly, which is not good for patients and it's not good for workers. So I guess that long story was just to say, I can't tell you specifically, I don't have a piece of paper that says, yes, so they're definitely, being run by private equity. I'm just going to make that leap of faith because that's what's happening to our healthcare system all across the country. But I do think it was important to understand the healthcare landscape and how it has continued to shrink in our community, as Ms. Terry talked about with the charity system, which I didn't even live here at that point. We moved here in 2008. But at that point, we had 3 hospital systems, the 2-lane system owned by Healthcare Corporation of America, Louisiana Children's, and then Ochsner. And now it's just those 2. And obviously, when you have those duopolies, I was terminated for union organizing. I can't go work in another hospital in our city right now. I'm pretty much blackballed at this point, which again, not good for patients, not good for nurses. So I don't know, Ms. Terry, do you want to say anything else about that?
No, and just to talk about the nonprofit issue, because that's something that LCMC, the corporation that took over University Medical Center, did. So when the state decided they no longer wanted to do healthcare and put it up for bid, it was LCMC that got that contract. So what they do essentially is they have a contract with the state. This one hospital where we at, I think there's 9 hospitals in their system. The state of Louisiana writes them a blank check every month for taking care of those individuals that either have Medicaid or no, they call it free care. There's no such thing as free care anymore. So they have the state contract to take care of patients in the open access hospital. They like to do the shroud of nonprofit, but as Mike was saying, there is no such thing as nonprofit because they get quite a lot of money for taking care of individuals with Medicaid and or free care. So is it, it's corporate medicine at its best. It's corporate medicine, whether it's private equity or these corporations that form like LCMC, the one we're under. It's all for profit. And at the end of the day, if they can shrink care to its bare minimum, get the cheapest workers that they can. RNs are not revenue generating. You have to have us, but we're not revenue generating. So, if we can get rid of the RN staff as much as possible, replace them with less qualified, or as I said, the push now is to AI, Profits go up, bonuses go up, and that's really the name of the game right now. That's just what it's all about everywhere.
We're on the wrong side of the balance sheet.
Yeah, we're on the wrong side. But we know with all that doom and gloom, we've been energized by our ability to form this union and to do all the actions we've had, because we're in the deep, dirty plantation South, right to work. You don't do that here. You don't rock the boat. You don't go against massa. You are glad you have a job. And so for us to be as fierce and as solid and have the community like we have behind us is kind of phenomenal. We're not New York or California at all. Yeah.
Yeah. Yeah. I applaud your tremendous, tremendous courage in in building this movement and building this organization. This is I can't imagine what it's like to build something like this in Louisiana, which is a deep red state.
Uh-huh.
And
Uh-huh.
I you know I'm curious how the labor organization has been perceived by the other workers, by the other nurses, the reception that you've gotten as far as how they've been, you know, how they've been, have they been engaging with it? You know, is it, yeah,
Can I clarify the question? Are you asking how have the nurses responded to labor organizing sort of generally, or
well,
maybe you can clarify the
as
question?
far as your hospital, as far as like your hospital, like what has the reception been from the other nurses to the labor organizing that you've been doing?
Mm.
Go ahead, Mr.
Well, I say it's mixed. Definitely the majority of nurses wants this to happen.
Mhm.
It is a different concept. We have some young nurses who, and Mike can speak to this, just organizing on a whole, who's new to organizing any type of movement and are fearful. They're just, some of them are just getting their license. They've seen what's happened to union leaders like Mike, so they're fearful and hesitant. But I would say I have never in my entire career seen the solidarity and um, collectiveness that I've seen with this union. Nurses that I would have never talked to, never spoken to, nurses from departments. I work in a clinic, so I'm sort of separate from inpatient. We will see each other in the hallways or in the cafeteria, and there's a camaraderie and a togetherness, literally, I have never, ever seen in nursing. So I think on that hand, we're in a good space. We have a lot of work to do to keep people engaged, to let them know that we're part of a broader struggle. It ain't just not about UMC. And in terms of the community and labor movement in New Orleans, I think we're a leader. Wouldn't you say, Mike? People are looking at us. I mean, we're 700 nurses who voted yes to do this, and we're, you know, not stopping. And even though it stalls and the hospital does a lot of that dirty stuff, dirty tricks and gaslighting, the rest of the community, when we have a strike or an action, we have organizations and community members that are there always. Longshoremen, IATSE, CEIU, communication workers, they come to everything. AFL-CIO, I mean, they support us in every way. They lead letter writing campaigns. They have done picketing in front of the board's offices. They have really been our partners. And I think because it's also new. They're looking at us, and I think once we get that contract, they're I mean, it's going to be all open. They're really energized by us, and vice versa. Wouldn't you say, Mike?
Yeah, I know. I think that's beautifully said, and I don't know that I have a whole lot to add to that. I think we have really, I believe, brought an energy into the community and into our hospital. Um, I think, we've missed Terry and I have talked about this, and Marcus in our, kind of chats back and forth. I've talked about it. You know, I, I really think, we really think that nurses can be, um, for lack of a better phrase, the tip of the spear, I think, in helping to organize labor across this country. Not the traditional um, trade labor, um, but to take the sort of old school, kind of trade laborers, which are, um, just aren't what they were in the turn of the century and in the 30s. But like we need that to grow and to bring those different disciplines and different sectors together who maybe wouldn't necessarily be working together, but we're all labor. We're all labor, and the world cannot function without us. And so I think that the energy that Mr. Terry talked about that we've just really brought to this region has been really inspiring. I have felt so inspired by leaders like Ms. Terry who have been doing this for so long and continue to show up and fight every day. So many nurse leaders that we have in the hospital who continue to push. And also, and I think, Ms. Terry, you can probably speak this as well. Like I've been doing organizing work in some form or fashion for 25 years, and I'm still making connections on how power works and
Yeah.
how
Yep.
it just in it just it's just insidious in the way it works
Mm-hmm.
into every corner of our lives. And I still am making connections. So why am I saying that? I'm
Mm-hmm.
saying that because like you're just coming out of nursing school and you've never really thought about this stuff. That's the beginning of a conversation. But our
Mm-hmm.
experience is that like people grab onto it and they feel something, when they're because they feel like they have a little bit of control when you don't have any control in the hospital. You
Mm-hmm.
just don't. You're just like trying to keep up. And so, but you just got to keep going, and this is not over. We're still in this fight, we just have to keep showing up every day. So,
Yeah, I think it's been good. And for me, coming from on the end of my career, as it were, or towards the end, I try to use that to people like, you should be at home sitting down taking care of your grandchildren, although that still happens as well. Um, I think they're inspired. Like, what makes you continue to do that? Was for everybody coming behind me, and again, I think the labor movement is at it's at a turning point right now. Everything that's happening, all the fascist stuff that's going on around us, is really sparking movements, and it's sparking people to get involved that I would have never thought would have been involved, and it's sparking alliances. Mike and I talk about this. We're part of the CLP here, which is, rugged, good old boy, kind of the good old white boy who, I mean, loves us, loves me. We go to the meetings and we're like, yeah, it's the nurses. And it's alliances and connections because we utilize that we are the most trusted profession consistently in this country. And there's a reason why. And so people recognize what our struggle is, not just our struggle. When we do better, and it's not cliche, everybody does better. Every patient coming in there. And we always like to say that we're probably, the one group of people you're going to see coming in and going out. You're going to meet a nurse. It's just, we're inherent. So we use that. We do.
Wow, that's beautiful. Um, so like I feel like so nursing is a really high leverage um uh job in the sense that it's kind of a critical need. Um and so when Mike mentioned that that nurses could be the tip of the spear as far as the labor movement in the South, that really kind of got the hamsters rolling in my head as far as like, wow, that's actually that's completely right. I mean, that's you know, nursing is super high leverage. Um, and if 600 nurses say no to something, uh, and like they, you know, what can they really do, right? Like it's
Mhm.
that's kind of you know, could you guys like, you know, kind of back me up on that, or you know, kind of as far as like, I feel like that your nursing, your struggle, as far as you know, it is can be really visible as far as, I mean, if you have the ability to organize this many nurses, get this many nurses on board, um, I'm curious, like, why you haven't gotten more attention. Uh, because that's kind of like amazing, you know,
Yeah.
and it's like a groundbreaking thing because nursing, if that happens and the hospital comes to a screeching halt as far as you know the operations of the hospital, um, then they sort of have to come to the table, right? So
Mhm.
like, so I'm just kind of like curious, like why hasn't this gotten more visibility?
I guess I could take a crack at that. I guess I would. I'm going to take a leap here and say when you're referring to more visibility, maybe more national visibility. Is that?
Yeah,
Mhm.
yeah, like more national visibility.
Mhm.
Yeah, I think that's a
Yeah,
fair question. I mean, I think I'm unfortunately I'm not on Substack is my only social media, so, if it can even be considered social media. Um, so I know that we have a pretty significant, social media presence, which obviously gets pinged around, everywhere. I will say for sure, this is the biggest labor fight going on in the South, and certainly amongst, kind of media outlets. We do get a lot of press here, but in terms of nationwide, that's a good question. I don't have a great answer for you other than to say that, we're up against we're not just up against the hospital. We are up against an entirely entrenched system of political power, that has ruled this state for 400 years. I learned recently that Louisiana was actually a corporation in between, French and Spanish rule.
a
They were
corporation.
owned by a corporation from. I'll send you the link. Anyways, very interesting story. The point is that like the roots of like, moneyed interest and power in this state runs very deep. And you would think that when, um, our union goes on strikes all the time around this country, they go on 1 and 2 day strikes, and they tend to bring the hospital to their knees because it's so expensive. But here, I think the hospitals really understand, and the power structure really understands that if they settle a contract with us, you know, that's a deck of cards to fall down. And we
Mhm.
know that too. And we're not giving up. Um, because there's just too much at stake. There's
Mhm.
too much of our population that needs hospital systems to function, and they need trained and skilled nurses to be at the bedside taking care of our people. And
Yeah.
we can't do that if the hospital is their primary goal is to make profit, and that's kind of what we're up against.
Wow.
Why that doesn't have a larger national scope? Just, just wait, because I'm sure it'll
Well,
catch up at
I
some
think
point.
too. I think too much. To piggyback off of you, Mike, they're willing to spend whatever they need to spend. I think what so far in union busting and bringing in when we have gone on strike, the first time they brought in contract workers, locked us out the hospital. So far in union.
Sorry.
Oh, and so I think that because they know since this is a duopoly, once they fall, the other hospital's not far behind. So I think the two major corporations have gotten together here and have really done such a good job of union busting it to say it. I hate to admit it. And steering nurses away from, new nurses coming on because they're willing to spend whatever it takes. This hospital is one of 9 in this system, in the LCMC system. So now they've adjusted with our strikes and just pull in nurses from the other hospitals, which are not protected. They will cross the line because they're not protected. They can be threatened with losing their job. They're not in a union like we are. We're the only hospital in this system that's fighting to become unionized. So they've adjusted and have figured it out. We know what the next strategy is, and we've done multiple 1-2 day strikes. The most we've done is maybe 3. We know what we need to do. We're willing to do that. It's going to be the mobilization to doing that. And we know that is what it's going to take. Is to bring them to the knees, is to not give them the ability to adjust. But we also are nurses. And we also live in a city that has poor health outcomes. And we also live in a city where crap happens. And we also know if something happens and we on a line, we going back in there. That's the inherent part of nursing. So to get nurses to get out of, but what if something happens? We're still worried about that. Those other guys are not. They're more worried about if they can't make the money they're making in the clinic and the surgeries and the outpatient procedures, where we're constantly, and even so when we are on strike, we have a group within our striking group that if there is a trauma or, a multi-trauma coming in, we're going back in, where we're ready to cross our own line, as it were. But I think they've been very, very good at spending a whole lot of money gaslighting, convincing everyone, particularly the powers that be with money here. We've done equally as well, trying to get local politicians to listen to what we're saying and to understand the importance of what we're doing. But we know they've dug their heels in, and I think that's why we don't get the attention we are getting. We have had a wonderful Zoom call with Senator Bernie Sanders, who's totally on our side.
Nice.
So we're thinking next strike, we want Bernie out there with a sign. We'll be going for. That'll bring some attention.
Looking forward to seeing that.
Yeah.
Yeah. So I guess we can kind of go into a little Q&A with the audience if they have any questions. I do see one question. It says here, are today's nursing students as dedicated as the experienced nurses, and are the requirements harder or easier?
Do you want to go, Mr. Terry?
No, you go ahead.
I don't. God, that's a really good question. It's a hard one to answer because I don't know that it's the maybe a fair question.
Okay.
If I could say that, because I think it's like my assumption is people go into, like most of us, we go into nursing school because we want to be helpful. A lot of people will talk about nursing as a calling. And that's not necessarily that way for everybody, but there's some bent towards like wanting to be helpful, to have a job, and there's obviously stability in nursing, et cetera, et cetera. But people come out of nursing school, and I can just say as someone who's come out of nursing school a little more recently than Miss Terry, you come out, and I'm old enough to have been pretty clear-eyed about what I was going to walk into. And even what I walked into was like beyond what I could have possibly imagined. I mean, just beyond. Like if someone stopped me and said, what is your patient here for? I would say, I have no idea. I'm just trying to keep up. There's a saying in nursing is like, get your roller skates on. Like it's a funny joke that you're never going to stop moving. It's like,
No.
it should not be that way. And so I think the dedication question, I think, just so trying to figure out how to say this, but like, it's not really about dedication. It's about like that. It doesn't really matter how dedicated you are because you're just put. And these are young nurses who come out, and there's no older nurses to teach them anymore because the older nurses have left.
Mm-hmm.
And so often when you go into a hospital, the nurse that's probably taking care of you was probably trained by a brand new nurse who
Mm-hmm.
maybe has a year of experience. That's not a good situation for patients.
Yeah.
So that's the best I can do to answer that. Yeah.
And I agree with you, Mike, as a what I like to call myself, a vintage nurse. Um, a couple of things. Just as medicine has changed, so has the education. And so unfortunately, many of the schools are geared towards telling nurses that they're going to be registered nurses, are going to be administrators and in charge. That training I received from the nuns, I was trained by the Daughters of Charity at Charity Hospital. I was trained to take care of people.
Mm.
You could progress your career and get your career, but my orientation and training was completely different. And I think that is what's happening to a lot of the schools. RNs are supposed to be in charge. RNs are supposed to be in administration. Bedside, once again, because we can do bedside cheaper. We can do bedside with a robot. We can do bedside with a medical assistant or a patient care technician when that's going to make much, much, much less money. And let's keep our RNs, let's give them this attitude of, being in charge and being nurse administrators and nurse leaders, where we're not wanting them to remain and stay at the bedside. So we're going to make conditions bad. We're going to make it, where a nurse does not want to stay. And if she does stay, she's going to be bombarded and not able to keep up. So I think the schools of nursing is having the same issue as medicine, healthcare in general. The perspective and rationale has been so geared towards profit across the board that it makes it look. And if you or anyone has gone to the hospital and, I've hit the bell, the nurse doesn't come, and, what's up with the nurses? Or she was so short and, surly when she did come. She's probably overwhelmed, not trained well, not precept well. I'm never asked to precept anyone. I'm never asked to show anyone the licensed nurses, licensed practical nurses who are below the grade of an RN. I'm never asked to train them. I'm never, which amazes me because I have decades of experience. But they don't. For some reason or other, the whole perspective about nurses being at the bedside and giving good care has just been devalued. So I don't know if it's dedication, and I think it's a matter of training and perspective that we've lost. Yeah. Can I say it myself, to be honest? When I have a family member goes to the hospital,
Mm.
I'm like, oh no, I gotta be with you. I gotta sit with you. I don't know what they taught those nurses. So I do. Mm.
Yeah. Yeah,
And
you mentioned AI. You said that
Mm-hmm.
robots are being
Mm-hmm.
introduced. Could you expand a little bit more? Because I always thought of nursing as something that was
Yeah.
almost like untouchable by,
No,
robots.
unfortunately, no. And doing mostly they're called assessments. There's a get the name of the company. Unfortunately, the company that's introducing this technology is the same company that is doing a lot of the horrible defensive surveillance. I can't remember the name of this man or this company in Gaza. They're doing a lot of surveillance and technology for ICE. And now they've gone into, and I learned this on this conference recently, they're introducing a lot of the technology, which is more or less assessment based. So when a patient comes in, these AI will be trained to do an assessment on the patient's needs, and also um, to answer call lights. So, you go in, you need a nurse, you hit the bell. It may be that AI technology that's triaging your need or what you're asking for, and then trying to address that need, either by sending in a patient care technician or calling a doctor if that's what's needed, but totally bypassing the nurse coming in and looking at you.
Well,
Wow.
Miss Terry, can you actually? Because I think we've got. It looks like we got 34 viewers on this stream. Can you
Mhm.
just say a little bit more about why is that a problem?
I can't go on. Nursing is inherently human in terms of need touch. It's in terms of those things that you pick up just from being a human. I can't tell you how many times I've gone in to address one issue and was able to assess and determine that there was other things going on. I can't envision the best of technology, the best of AI being able to do that. The ability to heal, the ability to make someone comfortable to actually heal themselves. Healing is a process, is a function that we are the navigators of that. We help people heal. We give them those tools to heal. We take out that human touch. We take out that human component, and I just don't know what we're looking at in terms of good, healthy outcomes. Mike, you can talk to this. I just can't see where we're going to have good health outcomes if we don't have a person that we're responding to that can just pick up all those nonverbal cues. The nonverbal cues I pick up in a day, a look on someone's face that lets me know they're in pain, the twitching of their body, all those things I pick up that has nothing to do with language.
Yeah. Yeah. I mean, I would
Nothing.
just I'd put an exclamation point on that by just saying there's just so much that you just walk. Sometimes you just walk into a room and you don't know what's wrong, but you're like, something's not right here.
Right.
Something doesn't feel right.
No.
And AI is not going to figure that out. You need an experienced nurse who's been paying attention to that patient 24 hours, 48 hours. You know that patient, and you walk in,
Yeah.
you're like, something's not right here. I don't know what it is, but something's not right. And then you start doing some things to figure out, gather information. AI is not
Hmm.
going to do that. They never will be able to do that.
Never. Never.
Or like, changing their beds, and like, changing, to taking the customer, I'm sorry, the customer, the patient from, from one part of the hospital to the other part, and all the other things that, the really, in the interactions that,
Yeah.
1,000 interactions that nurses do with patients is I don't, I just don't really see that being
Mm-mm.
automatable. Um,
No. No.
and
That's
and
what
I,
we're
I
trying to
think what
figure
they're
out.
trying to do is they're trying to just do the absolute least that
Hmm.
we will be will a sort of passable standard of care
Hmm.
where they can avoid using nurses.
Yeah.
Is that an, an
Yeah.
accurate assessment?
Yeah. Yeah.
Yeah.
Yeah, I think that's accurate. Like the changing beds thing, they could hire, they'll hire, patient care technicians, PCTs, or, aides or whatever, pay them. And the minimum wage down here is still $7.50,
Hmm.
$7.25, something like
Hmm.
that.
Hmm.
It's like criminally low wages
Hmm.
in the deep south. And, they'll pay somebody dirt cheap wages just to come and to do all those things and, you know, try to siphon off
Yeah.
the nursing work to as much as they can to AI.
Right. Mm. Mm.
Yeah.
Hmm.
But
Well,
yeah. Oh, go ahead.
I'm sorry. Go ahead.
Well, I wanted to wait for your next question. We were getting a little too doom and gloom. I did want to bring us
Yeah.
back to
Yeah.
my pastor always our pastor, we go to the same church, and he always says, "What's the good news?" So, anyways, I just want to make sure we don't end on that note. But anyway,
Yeah.
if you had a question.
Yeah.
No, I was going to say that, perhaps bringing in um, some of the lower paid workers into the organizing
Hmm. Hmm.
would
Definitely.
definitely
Definitely.
extend, you know,
Yeah.
kind of make it a big tent of sorts,
Yeah.
with respect
Mm.
to, okay, so we're all in this together, right? So
Yeah.
like,
Mm.
Yeah.
yeah, uh,
Yeah, and I think once they see us win that contract, I think it will energize them as well. But what the hospital's doing in a lot of cases is outsourcing those jobs that typically, like in environmental service or janitorial services, food services, all of that is subcontracted out to other companies now because it's cheaper for them than trying to manage a workforce. But I think there's still there's definitely opportunity there for us to organize um, all of the healthcare workers in all the areas, and they're sometimes our biggest allies. Sometimes they know they can't strike, but they're there wanting a button, wanting a badge reel, giving us a thumbs up. So yeah, definitely.
that's awesome. Awesome. Um, if the audience doesn't have any other questions, I think we can, you know, wrap up. Um, but this has been a tremendously insightful stream. And if there's anything that I can do to put you guys out there, you know, actually, as far as like I want to try to build up my YouTube channel. So, um, if I could get your permission, could I put you on could I put some segments on a YouTube
Yep.
short and
Yep.
blast
Definitely,
it out there? Okay, cool.
Yeah, that'd be
definitely,
fun.
Cool.
definitely.
Yeah, this would be perfect for a segment. And, I really want to get the word out there about what you guys are doing.
Mm-hmm.
Um,
Yeah.
yeah,
Yeah. Thanks so much for taking the time to talk with us, and I hope it was helpful and insightful, and you know, uh, it's like we keep saying, we're not going anywhere. This fight is too important. Our patients are too important. And right now, particularly in this moment in our country, as you have so eloquently written about in a few of your articles, we're not in a good way right now. We are being taken over by a regime made up of oligarchs by oligarchs,
yeah,
Or
and
oligarch.
labor is the enemy. And I really believe that labor
Hmm.
is the way out of this. Now, how do
Hmm.
we get there is a different issue, but I do think that it is really the answer, because they can't do what they do without us. And I think as long as we continue to organize and keep putting one foot in front of the other, and marching ever forward, that we can do this, both as nurses in the hospital, but as labor moving forward, that I think, because everybody works and everybody has to put food on the table.
Yeah.
yeah.
So,
Yeah.
yeah. So
And
thank you
and
for the time.
Beautiful
platforms
day.
like you, Marcus, platforms like you, keeping the word out, giving us opportunity to share stories is crucial. So thank you for
Yeah.
that.
Thank you for sharing your story. Thank you
Hmm.
for sharing your story. And this is, is whatever I can do to help this movement, because, you know, we want to build a strong labor movement in the United States.
Hmm.
And we're not there yet, as I was, talking to Mike earlier, but, you know, we're getting there.
Yeah,
Um,
we are. Hmm.
we're definitely getting
Definitely.
there. It kind of reminds me of I was watching some labor organizing by some Starbucks
Hmm.
union folks, and a guy came up. He was the spokesman of the union, and he spoke in very hushed, understated tones. He was kind of timid, a little bit, kind of like, you could barely hear him. And it was almost as if he was ashamed of making his demands, making his needs met, you know. And I feel that is kind of where the perception of labor, we're kind of at that point. Americans are not are not quite at the point to where they feel comfortable making uh making their needs met via labor organization. So that's something we need to work on. And I want to get people fired up. And I thank you guys for coming up on the show and telling me your story and telling me and just enlightening the audience. So
we thank you. We thank you for platforming. You definitely are invited to our next action. Because I'm sure it'll be fun.
I can make it.
Keep your ears on. We'll keep you up to date, and certainly look forward to continuing the conversation. So thanks so much.
Thanks so much. Thank you, Marcus. Have a good one.
I got it.
Yeah, bye.